Drug abuse in Nigeria has emerged as a major concern, especially among the youth. According to the United Nations Office on Drugs and Crime, there were 14.3 million drug users in Nigeria in recent years, with 3 million Nigerians affected by drug use disorders. The country is now at a critical juncture in its battle against drug abuse, a widespread crisis that transcends regions, demographics, and socioeconomic levels. From bustling cities to remote rural areas, the consequences of substance abuse are being felt across the nation, leaving families devastated and communities struggling to cope. In this special report, ADBN's correspondent Adaoka sheds light on the growing epidemic of drug abuse. Take a listen.
In recent years, drug abuse has emerged as a pressing social concern. From urban centers to rural communities, the issue has infiltrated various strata of society, posing significant threat to public health, safety, and the future of the people.
Drug abuse, by definition, is a compulsive, non-clinical use of psychoactive drugs, despite the obvious danger to the abuser. Even the abuser that sees that things are going wrong, he cannot stop. That's why I say it's a compulsive. When you use the word compulsive, that means there's a compulsion. There's a compelling reason why it must be done. And that means that there's a force that is acting on a drug abuser, that is making him or her not to be able to stop abusing. And that's why I say, despite the obvious danger, there's a compulsive, non-clinical use. Let's also look at what I mean by non-clinical use. Drugs can be used clinically when an ailment has been properly diagnosed and identified, and medication is prescribed. For that, considering the age of a patient, considering the dosage system, considering the duration, considering everything that should be considered before a medication is prescribed, that is a clinical use of drugs. But when somebody is using a certain substance, because when we say drug in this case, we also mean substance. When somebody is using a substance in a way that is not prescribed, and that there's no tenable reason why the person must use it clinically, we say the person is using drug in a non-clinical way. So I take the definition again, I say it's a compulsive, non-clinical use of psychoactive drugs.
Emerging markets are also experiencing a surge in drug abuse. The problem is no longer confined to illicit drugs. The abuse of prescribed medications, including opioids, benzodiazepines, and stimulants, is fueling a parallel crisis.
So when you are using the drug for a non-medical reason, you are abusing the drug. That is one aspect. Also, secondly, another aspect of drug abuse is, which I believe almost everybody is guilty of, how we even use the drugs that are prescribed for medical reasons. For instance, when you are told to use drug 8 hourly or 12 hourly, but oftentimes what you find people do, they'll just say, when you say 8 hourly, one morning, one afternoon, one in the evening. It's an abuse of that drug, because it's unlikely that you're going to even get the benefits of that drug, but exposing yourself to the chemical for a reason that is almost non-medical.
Families are torn apart as parents lose custody of children, siblings grieve over drug-addicted loved ones, while communities grapple with rising crime rates linked to drug trafficking and abuse.
When you use a drug that was not prescribed, you didn't run any tests, it was not prescribed by a physician, you're abusing that drug. There is overuse, there is underuse. Even when you're taking underdose of a drug, it can also be classified as a drug abuse. So yeah, and most especially the illegal drugs, that is the most general one people know, but the other misusage of drugs are also classified under drug abuse.
The ripple effects are equally devastating. Experts agree that addressing the drug abuse crisis requires a multi-pronged approach.
Interestingly, it will not be quite good to narrow it to field of practice, because in the field of practice we use clinical drugs. But the drug abuse goes beyond use of clinical drugs. There are drugs that have not found clinical applications that has been abused. For example, alcohol is not a clinical drug, but it's one of the drugs that can be abused. We can also give an example of a petrol. As you see petrol, people abuse it by sniffing or trying to inhale the gas that comes from it. It does not find clinical application, but it's also a drug of abuse. So generally, in Nigeria, the drug that is most abused is cannabis. And what is cannabis? Because that should be the answer. Because some people will not understand what cannabis is. There is cannabis, we can call it a shrub. You know what I mean by a shrub? A plant, but of a kind of average size, average height. It is native to, I think, Central Asia and Southeast Asia. And you also find it in Africa. It has two different species. The one that you call Indian hemp in our climate, and another one that is called cannabis sativa. The two of them are two different species of the same plants.
Drug abuse is a public health emergency that demands urgent, sustained action. It is a battle that requires the collective efforts of governments, healthcare providers, community leaders, and individuals.
What we are saying in essence is, what are we doing and what can we do, or what have we been doing? One, I want to suggest that advocacy, which is education. Education is very important, and I want to actually congratulate ADPN TV for having this kind of program. Once, because this is an attempt to educate the public on the dangers of drug abuse. We cannot do enough of this. I must tell you, we need to keep doing, and we need to go down to the hinterlands. In the primary school and secondary school, we need to have club, drug abuse club, where with such club, the drug awareness among small children to know that drug abuse is not good. Because when people don't know, they become a victim of their ignorance.
The road ahead is long and fraught with challenges, but with a commitment to understanding and addressing the root causes, there is hope for a healthier, drug-free future.